I will be presenting in vitro strategies to overcome or to predict treatment responses for patients with CLL. And the principles that we base our research on is to look at the CLL cells ex vivo. So in addition to the genetic prognostic markers that we already have established for patients with CLL, we need something more to better tailor the treatments to the patients, because we see that the responses are very heterogeneous. So we do assays where we look at the cell signaling and cell viability and see if we can use these features to predict treatment outcomes. Yeah, so this is of course challenging. When you have a model, it doesn't reflect exactly what you see in the patient, but if you can use the model to mimic responses that we see in the patient, then the model is useful. So there are different approaches. You can have 2D models or 3D models, and there will be presentations about this also on Saturday. We use the 2D model where we stimulate the cells with factors that the cells usually are exposed to in the tumor microenvironment to mimic the tumor microenvironment. So still, it's early still. We are using these predictions just to establish models that can predict treatment outcomes. And in order to implement these in the clinic, we first need to validate them on different patient cohorts in retrospective studies, and then we would need to move it to prospective clinical studies to really confirm that the model is useful. And then there are, of course, several challenges to go from there to actually implement it in the routine practice with standardization and so on. But long term, we hope that this is something that we can do.